Hi, today we will learn about cephalosporins.
Today, we delve into cephalosporins, a vital class of antibiotics. They are part of the beta-lactam family, and were first derived from a fungus in 1948. The core of cephalosporins features a unique structure known as 7-aminocephalosporanic acid. This includes a beta-lactam ring, crucial for their antibacterial properties, and a dihydrothioazine ring. Structural changes at positions 3 and 7 create different drug generations. So, how do cephalosporins work? They inhibit bacterial cell wall synthesis. This occurs by binding to penicillin-binding proteins. This binding prevents the cross-linking of peptidoglycan strands, ultimately leading to cell lysis. Cephalosporins are renowned for their broad spectrum of activity. The effectiveness varies across generations. The first generation mainly targets gram-positive cocci, while later generations provide better gram-negative coverage. Let's look at some examples. First generation includes cephalexin and cefazolin, primarily used for surgical prophylaxis. The second generation, like cefuroxime, improves gram-negative coverage. The third generation, such as ceftriaxone, crosses the blood-brain barrier and combats meningitis, while the fourth generation, cefepime, is resistant to beta-lactamases. Lastly, the fifth generation includes ceftaroline, effective against MRSA. When considering pharmacokinetics, cephalosporins can be administered orally or intravenously. Many are acid-stable, and easily absorbed. They penetrate tissues well, especially third-generation drugs that cross the blood-brain barrier. These antibiotics serve various therapeutic purposes, from treating respiratory and urinary infections to more severe conditions like meningitis and sepsis. However, cephalosporins can cause adverse effects. Be alert for hypersensitivity reactions, gastrointestinal upset, and rare nephrotoxicity. It's crucial to know the contraindications. Those with severe hypersensitivity to cephalosporins or penicillin should avoid them. Also, keep in mind potential drug interactions, especially with alcohol and certain other medications. Finally, bacterial resistance is a growing concern. Resistance arises from beta-lactamase enzyme production and alterations in penicillin-binding proteins. In summary, cephalosporins play a crucial role in treating bacterial infections. Their unique structure and mechanism of action enable them to combat a variety of pathogens. If you have more questions or want to learn more about antibiotics, consider subscribing for more educational content. Your understanding could help combat antibiotic resistance.